Description of the ischium is probably the best if we start again from the acetabulum. Within the acetabulum, those lines of fusion are not visible, but it has been arbitrarily decided that upper 2/5 of the acetabulum are part of the ilium, posterior and inferior 2/5 are part of the ischium, and the anterior fifth of the acetabulum is something that belongs to this part of the bone, to pubis. Ischium is very simple to define and to describe because it does have a very massive body, and then anteriorly, superiorly, and medially oriented part, which is called the ramus of the ischium. So essentially the whole bone looks like a letter L with a body and the ramus being directed towards the ramus of pubic bone, and of course seamlessly they will blend into each other. If we take a little bit more posterior view in order to see the rest of the ischium practically hidden behind the acetabulum, we'll find out that there is a big massive spike. This is ischial spine, attachment point for ligaments running between the ischium of the hip bone and the posterior aspect of the sacrum. Between this spine and the rest of the ala, we will find a very deep inverted letter U shaped notch. This is known as the greater or superior sciatic notch, whereas inferior to the spine of the ischium there is a little bit less evident indentation that is called the lesser or minor sciatic notch. So greater sciatic notch, minor or lesser sciatic notch. When we define and describe bone, that's why we are talking about notches. In a living person, those notches will be renamed into greater and lesser ischial foramina because they will be made a full circle with existence of ligaments running between the dorsal aspect of the sacrum and two different parts of the ischium. Ischiosacral ligament and ligament that will run towards ischial tuber. This is another interesting finding for us. This is ischial tuberosity. I'm sorry, I mentioned it just a couple of seconds ago and I said tuber. It's a tuberosity. In English language it could be also frequently known as the sit bone. Essentially while sitting, it is this part of the hip bone that provides the rest of the body and the trunk, of course, the upright position support. So that is ischial tuberosity, which is seen exactly at the boundary between the body and the ramus. The tuberosity itself is quite thick in part. It could be easily found and identified through palpation within the gluteal region. Interesting to mention that it serves as the attachment point for all three hamstring muscles. On the lateral side there is biceps femoris and two that are more medially, semitendinosus and semimembranosus, collectively known as hamstrings. These muscles will be attached here on the ischial tuberosity. So as we move away from ischium, we need to follow its ramus, a branch. In many books this ramus is simply not mentioned at all because the whole structure between pubis and ischium, in some textbooks it's referred to as ischiopubic ramus. However, in some other books, a ramus of ischium exists, meets the inferior ramus of pubis, and then they blend. So this is the pubic bone. The pubis makes the anterior fifth of the acetabulum, and it is composed of two different rami. One which runs more horizontally, that is the superior ramus, and the other one which is known as the inferior ramus, which connects to the ramus of ischium. This is where the body of the pubis is, and practically at this structure here at the midline, we know that pubis from the left side and pubic bone from the right side are going to come together, forming secondary cartilaginous joint or symphysis pubis. Between ischium and both pubic rami, we're going to find a huge opening, the obturator foramen, which in a living person is really not so widely open, better to say that it is going to be quite closed by presence of obturator externus and on the opposite side obturator internus muscles. Between two muscles there will be enough space to allow passage of obturator artery and obturator nerve, practically from inside the pelvis onto the upper medial thigh. Superior ramus of pubis is more interesting for additional few details, so I will just try to go from the arcuate line to bring us back to iliopubic eminence, and then we'll find that there is one very sharp margin on the superior pubic ramus that is known as the Pecten pubis. Pecten pubis is attachment point for the pectineus muscle, so many of these landmarks are so conveniently named, you learn it on a bone, and then indirectly you know much more information about muscle, even ahead of time. So this is the Pecten pubis, and when we follow Pecten pubis, we're going to come to this little bump here, and that bump is known as the pubic tubercle. Certainly, like many other elevated parts on any bones of the human body, it must have been pulled out by the attachment of certain structure, and this time it is going to be a very interesting and important part of the anterior abdominal wall, which is known as the inguinal ligament. Inguinal ligament is attached to the anterior superior iliac spine, and then it runs obliquely down before it attaches once again onto the pubic tubercle. Inferior to the ligament, of course, you can see there is plenty of space, which makes possible that major blood vessels are having easy access from inside the pelvis out onto upper thigh, and the other way around from upper thigh back into pelvis, like what is femoral artery and femoral vein, for example. Finally, from the pubic tubercle, the most medial part, which also appears to be slightly enlarged and slightly thicker, creating a bit of overhang projecting anteriorly, is what is called the pubic crest. So in other words, going from midline, we have pubic symphysis, then pubic crest, taking us to pubic tubercle. And away from pubic tubercle, we follow the Pecten pubis to iliopubic eminence, and from iliopubic eminence following the arcuate line until we reach the anterior surface of the sacrum. Basically, a set of these landmarks, as they were just listed, from crest to tubercle to Pecten to iliopubic eminence and arcuate line, are collectively forming the terminal line of pelvis, which is, anatomically speaking, obliquely running plane, which separates. Inferior to the plane is a true pelvis. What is superior to the plane, it is lower abdominal content. Finally and lastly, let's address the acetabulum. As one can see, it appears to be a really deep socket, and it is not surprised that we're seeing this as one of the classical examples of a ball and socket joint, where a head of a femur is going to fit into this quite deep cavity that is on the lateral side of the hip bone. The acetabulum itself has a slightly raised margin, which is known as the acetabular margin or acetabular brim. And on the brim itself, there is a little bit of a defect, so to say, because should we continue with the same plane with the acetabular margin, it should be continuous across this gap like this. Instead, we have a big and deep acetabular notch, and there will be an interesting explanation for this. There is a transverse ligament of the acetabulum which runs and continues the acetabular margin, leaving the notch itself actually being a hole. Through that hole, there will be a blood vessel which enters and passes between the acetabulum and head of the femur. The blood vessel is known as blood vessel that runs inside the ligament of the head of the femur. And although it is quite small, it turns out to be one of these remarkably important sources of fresh arterial blood for the femur, without which femur will see practically earlier signs of osteoporosis and bone weakening, and perhaps this could also be used to explain why so many fractures of the upper femur really affect elderly population. Within the acetabulum, if we just zoom it in, although it's going to be a little bit harder to observe. There is a central part which appears to be the most indented area that is known as the acetabular fossa. As you can see, acetabular fossa is quite rough and it is not covered by hyaline cartilage in a living person. Next to the acetabular fossa comes the semilunar or lunate surface. That is the true articular surface that's covered by hyaline cartilage in a living person. And of course, against this articular surface, head of the femur will be performing its motion. This depressed part of the acetabulum is something also that we do not see regularly in many joints of a human body. In between the acetabulum and the femur, there will be additional accumulation of fat, so-called a fat pad. And that fat will prevent that while performing any type of movement, femur and acetabulum accidentally squeeze and pinch the ligament of the head of the femur. So with the fat pad being quite flexible and pliable, it will be always pushing itself away from a point of greatest pressure between these two bones, and indirectly it will sweep away also the ligament of the head of the femur, preventing any kind of accidental injury to it. Let us do the quick review of what has been done on this bone. I will let it sit stationary on the table, so for a little while we'll just play with the camera to go and try to capture the bone from a variety of different angles, like this. And we'll come back to a position where we started seeing the bone more from the posterior and lateral side. So this is the ilium with its ala, anterior superior, anterior inferior iliac notch. Posterior superior, posterior inferior iliac notch. This bone is slightly damaged here, so that's why the notch really is showing itself as something that doesn't exist. So posterior superior iliac spine, posterior inferior iliac spine. Then appearance of gluteal lines. This is the posterior gluteal line. This is here the anterior gluteal line, and just above the acetabulum we have the inferior gluteal line. So respectively we have attachment points for gluteus minimus, gluteus medius, and posterior to the posterior gluteal line, this part of the hip bone is used for attachment of gluteus maximus. This is the iliac crest, seeing it from the above to confirm it is shaped like a letter S. Attachment points for 3 flat abdominal muscles, the transversus abdominis, internal oblique, and external oblique abdominal muscle. On the inner aspect we have the bone showing iliac fossa, and further posterior to the fossa there is auricular surface and iliac tuberosity for proper formation of sacroiliac joint. Upper 2/5 of the acetabulum are part of the ilium. The ischium itself, posterior inferior 2/5 of the acetabulum, the body of the ischium, the ramus. Ischial spine, above it, greater sciatic notch, below it, the lesser sciatic notch. Where the body and ramus meet each other, ischial tuberosity, sit bone, attachment point for 3 different muscles, semitendinosus, semimembranosus, and biceps femoris. Ramus of ischium connects to inferior ramus of pubis. Finally, the pubic bone, superior ramus, inferior ramus, and in between pubic bone and ischium, obturator foramen. Superior ramus of pubis will demonstrate pubic crest, pubic tubercle, Pecten pubis, iliopubic eminence, and then the arcuate line taking us to lumbosacral promontory, practically being the landmark or a set of landmarks separating true from false pelvis. So for anyone who starts anatomy, it is of great benefit to try to have at least, and of course if possible, both hip bones at once. Placing them properly should not be a problem, and of course having a sacrum in between left and right hip bones will make things much easier to grasp the pelvis. But regardless, with or without sacrum, this bone is not so difficult to get oriented. Of course, the moment you see pubic bones, you know this is the anterior part. Obturator foramen is something that also has to be seen anteriorly, and acetabulum naturally has to point more to the posterior lateral direction.